Assalamu alaikum, everyone. Welcome to the second installment of Zoom In on the Halal Metropolis. My name is Jenna Shami with the Halal Metropolis team. For those who are new to the series, Zoom In on the Halal Metropolis is a video series where we take a closer look at how the Muslim communities of Southeast Michigan are coping with the COVID-19 pandemic. For returning viewers, thank you so much for joining us yet again. Today, we'll be speaking with Madiha Tariq about her role as Deputy Director of Access's Community Health and Research Center and how COVID has affected the Arab and Muslim communities of Southeast Michigan. Madiha, thank you so much for joining us. How are you doing?
I'm doing wonderful. Thank you for having me here.
Of course, I'm so excited to interview you. So, to begin, has there been research done on COVID in the Arab and Muslim communities with Access?
So, doing research on the Arab and Muslim community, especially as it pertains to COVID, has been a central priority for us. But as you know, very little research exists on COVID in general.
Right,
Unfortunately, the Arab American, the MENA community, is not considered a minority in federal
right,
agencies. So any kind of national research that was done did not include our community. And
yeah.
I think that this presents a really, really big issue for the community. For example, Kaiser Health did a national level study looking at vaccine hesitancy, and they asked all these different questions that I think would have been great to know, like how does political opinions intersect with, COVID myths or the level of vaccine hesitancy, reasoning behind vaccine hesitancy, and this research was only done in the Black community, the Latinx community, and some segments of it for American Indian, but we did not have any research on the Arab American community. So what we are really trying to do is, trying to work with academic partners now to do research on vaccine hesitancy or even vaccine access issues that exist in our community. There's been several surveys that are underway right now, but we don't have uh, any results yet. One thing I will mention is that we actually partnered with our some of our NAC, National Network member organizations, and we did a survey of 221 Arab Americans about a few months ago, just asking a simple question if they would agree to take the COVID-19 vaccine. And at that time, this is maybe 3 months ago, 47.9% of the respondents said that they would not receive the vaccine at this time.
Oh, wow.
Really, this is a really high percentage
Right,
of individuals, and we understand, there's biases and the sample can be maybe was not, big enough, but knowing that not just in this community, but in other Arab American communities around the country, there is this much, hesitance towards vaccine is concerning. So we will
right.
soon be starting to do some focus groups at Access with community members, finding out the reasoning why they would not want to take the vaccine at this.
Right. That's going to be very important, like community education, like health education on that would be like very vital, especially since I didn't know that percentage was that high. That's really shocking. So based off of that, can you give us a little insight on how COVID has affected the Arab and Muslim communities based on what you've seen? Like what disparities have you seen?
Sure. I mean, like most communities of color and immigrant communities, what the underlying causes, underlying issues that exist are similar, right? There's some
Mm-hmm.
things, for example, our community has a large number of people with pre-existing conditions and chronic disease, which obviously impacted a lot more people who, ended up being more susceptible to COVID. The second piece that I think is very common is a lot of immigrant communities, especially low income immigrant communities, work in the service industry. So not only they had greater exposure to COVID, but also they were economically impacted
Right.
by COVID. But I think the things that are really, and they're not unique to us, but they are specific to our community, is that our community is very much focused on togetherness and gathering, and
Oh, yeah.
that has had a really big toll on the mental health of the community as well. And it also on the safety of the community, because we cannot ignore there's a lot of people having weddings, and
Mm-hmm.
how you define social distancing is, I mean, it is a very broad definition depending on who you're talking to in the community, right? So people are like, yes, yes, I'm being safe, but maybe they're not wearing their mask properly, or they're going to gatherings. So it's like we do have a lot of community outbreaks as a result of that, And then the other thing also is, our community, we have so many people that come from overseas, that are coming from places where they did not trust authority, where the last
Mm-hmm.
time they saw a shutdown was the last time they were home, like the association of shutdown for refugee communities is very re-traumatizing.
Oh
Uh,
yeah. Oh yeah.
so I think it's really important to think about those things. And then when it comes to access to health, you know, for a lot of other communities, maybe this is not the case, but our community has been subject to the Muslim ban, Medicaid work requirements, public charge, all these policies that really creates this fear for them to utilize services that are available for free, whether it be testing or vaccines, or even going to the doctor or the hospital if you are having COVID symptoms.
Oh yeah. I know.
So it is, I mean, it is such a complex set of issues that impacts the Arab and Muslim communities.
For sure. And a lot of people don't like see the correlation with like immigration status or refugee status, or even like the fact of like culture. Like, I mean, I've even noticed with like my family, like we really relied on like family gatherings. Like that's all like we used to always do. So like seeing how that impacted my grandparents, for example, when we couldn't go visit them, like you see like the mental health effects and just in general with like the whole community, but like it especially hit close to home for me because like I saw it in my family. So I'm glad you mentioned that, so thank you. So have you, at Access, has there been public health initiatives to help cope with COVID in the community? Like I've noticed that you guys started like the vaccine distribution, so I'm really excited about that.
I think this, I think responding to this pandemic became the center of our priority right about this time last year, right when
Yeah.
everything was shutting down. We knew that we needed to find a way to reach out to our community. So around this time last year, we partnered with Wayne State University and started doing drive-through COVID testing. And
Mm-hmm.
our testing was different than other places, because when people were coming through, we were making sure that we are assessing them for the all the social needs that they may have, so that we can address those as well, because this is, for a lot of people, was the only human contact they were having with somebody else.
Right.
The other thing we also did at right at the beginning of the pandemic was we all pooled together and put together a list of our most vulnerable clients, and then we called them and basically asked them everything they needed, and then we did this expansive care coordination movement to make sure that that nobody fell into crisis, that we were
Right.
doing crisis management. And then, our clinic shut down for a little while, but we realized that because of the digital gap, the language issues, we could not maintain, we could not provide health services shut down. So as soon as we could, which I think a month and a half in, we ended up opening our clinic so that people could come in.
Oh, that's
Um,
great.
and I think that's what was really important. So it was distributing meals, building crisis management, having the clinic available, having our mental health staff available, doing home visiting, even if it's a knock on the door with your mask on to check on our clients. And because we were able to build this trust, I think our vaccine rollout has been going really swimmingly well.
Mm-hmm.
uh, we started vaccine clinics about 3 days. Monday was our first day. And
Really, that's awesome.
Monday we saw 450 people. Yesterday we saw 630 people. So every day it's grown bigger and bigger. And I think the reason why so many people are coming to us is because we made sure that we also left room for people to walk in.
Mm-hmm.
Because I will tell you something. If you look at the difference between appointments, people who made appointments and people who made walk-ins, you'll realize that it's really, really important to keep the walk-ins open because there are people who have digital gaps, language gaps, age, all these other factors
Oh yeah.
that they are not able to even picking up the phone, able to make an appointment.
Right.
And when we first opened up our phone lines, we got so many calls. I think on the first day our phone crashed 7 different times. And I know some other agencies who said, oh, you really need an online system. And I said, and we said, no, we need to make sure that if the phone line drops, we're gonna pick it right back up and
Oh yeah.
people, because otherwise they will not be able to reach us.
Right,
So
right.
that's been a very important part of our vaccine rollout process.
Yeah, because I mean, especially like some people don't have access to like online usage with computers, so having like that phone is like very important. But wow, I did not know you guys were reaching that many people, and that's like awesome because then you just see right there, like, so like it's just by word of mouth too. Like, oh, I'm gonna go get the vaccine, then somebody else is like, oh, maybe I can go get and have that access. So that's amazing. So I'm really glad you
I'll
guys
tell you
started that.
something. I'll tell you something really funny. I had this 2 or 3 women in the line today that said, "Oh, we sent our husbands yesterday to go scope the scene. This is worth our time." And today they all showed up. So they, they sent their husbands yesterday, and then when they saw that it was, safe and the process was smooth, they themselves came today.
That is awesome. Oh my gosh, that's so amazing. That's like I'm so happy. Like I'm telling you, when I found out that Access was doing like the vaccine, I was like sending it to so many people. I was like, "Hey, you could go get the vaccine now. Go try it." I was like so excited. So I'm glad you got to talk about that. But our time is coming close to an end. So thank you so much for speaking with us today. I really appreciate your insight on like the whole research process and like the disparities within the community and highlighting the needs and advocating for the community. So I really, really appreciate that. Again, if you're a listener and you have a story you would like to share with us or to be featured on the Zoom In series, please fill out the form linked below. And I'm wishing everyone safety and health. Until next time, Assalamu alaikum.
Assalamu alaikum.